Have you ever stopped to think about what's actually going on inside your veins right this second? For hundreds of thousands of people, there's a silent threat forming, a blood clot. It's a condition called venous thromboembolism, or VTE for short. And today, we're going to pull back the curtain on this hidden danger.
Just look at this number. Every single year, right here in the US, as many as 900,000 people are affected by VTE. To give you some perspective, that's enough people to fill the biggest football stadium in the country 10 times over. That is a staggering number for a condition that, let's be honest, most people have never even heard of.
So that really is the big question, isn't it? What exactly is this threat lurking inside our own bodies? How does it even start? And maybe most importantly, what can we do about it? Let's dive in.
All right, first things first, we need to get a really clear handle on what VT actually is and why it's so incredibly dangerous.
So, at its most basic level, VTE is pretty simple to understand. It's just a blood clot that decides to form in a vein where it absolutely shouldn't be. But this very simple definition quickly splits into two very different and very serious problems.
You see, VTE really has two different faces. It almost always starts out as a deep vein thrombosis, or a DVT. That's a clot that's formed deep inside a leg vein, and it can cause some pretty noticeable pain and swelling. Now, by itself, a DVT isn't usually a killer, but here's where it gets really scary. The true danger, the reason we call it a silent threat, is when a piece of that clot snaps off. It can then travel through your bloodstream all the way to your lungs where it gets stuck. That's called a pulmonary embolism, or a PE. And that can be fatal in a matter of minutes.
So you might be wondering, how do these things even happen? Is it just random? Bad luck? Well, not really. It turns out there's a surprisingly specific recipe for creating them.
You know, the crazy thing is, the playbook for understanding all this was written over 150 years ago by a physician named Rudolf Virchow. His idea, which we call Virchow's triad, is still the absolute foundation for how we think about VT risk today.
So Virchow's triad basically lays out three key ingredients for this recipe for disaster. First, you need sluggish blood flow, what doctors call stasis. Just picture your blood kind of pooling instead of flowing smoothly. Second, you need some kind of injury to the wall of the vein itself. And third, the blood itself becomes thicker, more likely to clot, a state we call hypercoagulability. You get those three ingredients in the same place at the same time, bam! You've got the perfect storm for a really dangerous clot.
And this is where that triad thing stops being theoretical and starts getting very, very real. Just think about something like a major hip replacement surgery. The patient isn't moving, right? That's your sluggish blood flow. The surgery itself causes an injury to the vein, check, and the body's natural stress response to that trauma makes the blood more prone to clotting, check. That's all three parts of the triad in one event. The same goes for being stuck on a long flight or having a bad fracture, but it also applies to ongoing things like cancer, pregnancy, or obesity. Each one of these is a situation that sets the stage perfectly for that dangerous recipe to come together.
Okay, so we know what causes it. That's the scary part. But how do we fight back? The good news is, medical science has some seriously powerful tools to stop these clots right in their tracks.
The number one weapon in our arsenal is a class of drugs called anticoagulants. Now, you've probably heard these called blood thinners, right? It's a super common term, but it's not totally accurate. They don't actually make your blood thinner. Instead, what they do is way more important. They stop new clots from forming, and they keep any existing clots from getting bigger. This gives your body the time it needs to naturally break them down.
And this kind of therapy has come a long way. For the longest time, the gold standard was a drug called warfarin. It works great, but it's famously tricky to manage. It needs constant blood tests and monitoring. But then, things really changed with the arrival of modern pills, called DOACs. They're so much simpler, way more predictable, and just make life easier for a lot of people. And of course, for emergencies in the hospital, we have the fast-acting injectable drugs like heparins. They work almost instantly and can act as a crucial bridge until the other meds kick in.
Look, treating a clot after it forms is obviously super important. But what if we could stop it from ever happening in the first place? That's the real game changer. And that brings us to maybe the most critical part of this whole story: prevention.
I want you to just let this sink in for a second. VTE is the most common preventable cause of death for people who are in the hospital. This isn't just some dry statistic. It's a massive call to action. It means we already have the tools to stop these tragedies before they ever start. But, as we know, just because something is preventable doesn't mean it always gets prevented.
So how do we do it? Well, there are two main game plans, two different tools in the toolbox. On one side, you've got mechanical prevention. This is all about physically forcing the blood to keep moving, using things like tight compression stockings or those inflatable leg sleeves you sometimes see in hospitals. This is the go-to method for patients who have a high risk of bleeding. Then on the other side, you have medical prevention. This involves using low doses of anticoagulants, like a small shot of heparin, to stop clots from even thinking about forming in high-risk patients.
So who gets this preventative treatment? Well, it's pretty much standard of care for high-risk patients in the hospital, whether they're in for a medical issue or a surgery. It is absolutely essential for anyone going through major orthopedic surgery, like a hip or knee replacement. But here's something interesting. It's not usually recommended for people who are just stuck at home, not moving around much. That really tells you just how much of a risk factor the hospital setting itself is.
So, what's the bottom line here? What do you really need to take away from all this? It's that knowing your own risk factors, especially if you or someone you love is heading into the hospital, is incredibly powerful. You should never be afraid to ask the doctors and nurses, hey, what are we doing to prevent blood clots? That kind of awareness and advocacy can literally be a lifesaver.
And all of this leaves us with one last, really big question to chew on. We know for a fact that the vast majority of these dangerous clots that people get in the hospital are preventable. We have the science, we have the tools. So we have to ask ourselves, is our healthcare system consistently doing enough to protect every single at-risk patient from this silent threat?